everyone. Welcome. Welcome, everyone, to today's Spotlight Series episode. I'm Andrea Piche, Senior Program Lead here at Healthcare Excellence Canada. I use the pronouns she and her, and I am pleased to be your host today. Before we get started, I'm just going to go through a few technical components. I just want to ensure that all of you joining us from across the country have what you need to have a great online positive experience. So please, first of all, note that this session is being recorded. And we are pleased to offer French simultaneous interpretation provided by Boost Events, a subsidiary of Boost Lingo, for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. Now, if you don't see that interpretation menu, what you might see is a little ellipsis and then 3 dots. This is the More menu. And if you click that, you should be able to select interpretation. We invite you to share your questions and comments at any point using our chat box, and you can do this in either French or English. We also encourage you to respond to the comments and answer each other's questions in the chat if you wish, and it'll be fun as we go along to see your conversation. If you need any support at any time during the webinar, you can reach out to our tech support or Soutien Technique using the direct chat feature. I'd like to start by sharing that I'm joining you from my home office in Grimsby, Ontario, which is the traditional territory of the Anishinaabe, Haudenosaunee, and Ojibwe Chippewa peoples, covered by the Upper Canada Treaties. I recently had an opportunity to hike along a beautiful area here in my region called the Niagara Glen. And it's a gorgeous landscape that follows the water downstream of Niagara Falls. And what was really special about this hike is that it was accompanied by a self-guided audio tour titled Rekindling All Our Relations, which offers a beautiful combination of Indigenous wisdom and soundscapes curated by Michelle Elise Burnett and sound engineered by William Reich Jr., who are both respected members of Niagara's Indigenous community. And as I reflect on that experience and the gifts that were shared through that audio in the context of this year's Canadian Patient Safety Week theme, All Voices for Safer Care, I was reminded of the many voices of our First Nations, Inuit, and Métis communities who aren't listened to, who aren't invited into the conversation, and who are judged before even saying a word. And so I invite you today, but throughout this entire week, to reflect on the voices that you want to take action to invite into your spaces in an authentic and meaningful way. I'd also like to invite you to introduce yourself in the chat. Let us know a little bit about the lands you're joining from today. And thank you in advance to our HEC colleagues who were going to put the Native Lands website into the chat where you can learn more about the territory you're joining from. Now about our Spotlight series. This is an opportunity to have a focused, constructive discussion and explore solutions to make improvements last as we work together to shape the future of quality and safety in healthcare across the country. Today's episode is titled From Awareness to Action, Beyond Harm Toward Safer Care. And it's a special edition of the Spotlight series that's guided by this year's Canadian Patient Safety Week theme, which I mentioned is All Voices for Safer Care. This year's theme is an invitation to listen more deeply, to ask important questions, and to take meaningful action together. Safer care doesn't happen by chance. It requires collective responsibility, courageous conversations, and systems that make space for every voice. So whether you are here as someone who delivers care, whether you're supporting a loved one, whether you lead a team, maybe you're involved in shaping policy, your voice matters. This conversation is an opportunity. We can explore how we can move from knowledge to action and how we can together make healthcare safer for everyone. Our panelists will share insights gathered from their work and their experiences on how we can strengthen safety, how we can build trust, how we can drive meaningful change by making spaces for all voices. So throughout today's conversation, I encourage you to think about how to recognize, share, celebrate actions that make care safer. Right? This is a proactive approach. Right? We want to explore and learn and act before harm occurs. And so this highlights the importance of recognizing and celebrating when and why and how things go well, rather than solely focusing on learning from when things go wrong. So as part of HEC's Canadian Patient Safety Week materials, you'll find an activity card that you can use in your teams and with your community to explore everyday safety acts. And throughout this webinar, if you want to, please share your everyday safety acts in the chat. Tell us about something you're doing great, something you've implemented, something that's going well, something that is really serving you, your community, in creating a safer space. And while some of these may seem small, their consistent use can have a big impact. And so together they will help form the foundation of a safer healthcare system. And now I am pleased to connect you with our guest speakers. Joining us today, we have Lorraine Thomas, who's a manager of inclusion, diversity, equity, accessibility, and anti-racism at Holland Bloorview Kids Rehabilitation Hospital. We have Christy Ruff, Executive Director of Culture and Wellbeing at Horizon Health Network, Dr. Nancy Humber from Lillooet, British Columbia, and Harjeet Kaur, a patient partner and advocate. Welcome, all of you. It's so nice to have you here. Thanks for being here. If you want to, you're all welcome to come in. I see cameras already. If you want to take yourselves off mute as we go. And maybe we could just start with having you each introduce yourself. If you want to share a little bit about who you are, about you know, your connection to today's topic of all voices for safer care. And specifically, maybe a little bit about what safer care means to you. Maybe we can start with Lorraine.
So thank you, Andrea. So it's my pleasure to be here today. So as she noted, I'm Lorraine Thomas, and I'm a manager of IDEA at Holland Bloorview Kids Rehab in Toronto, Ontario. So Treaty 13 land. I've been a healthcare professional for almost 25 years, and I've worked both as a frontline and as administrator. I'm very excited to be part of this conversation because safer care must include diverse voices. And I believe that when we center inclusion, we strengthen safety for everyone. On a more personal note, my lived experiences as a racialized Black woman with a disability and my professional experiences have taught me that safety is not just the absence of harm. It's a presence of trust. It requires respect and cultural humility. And it also applies to patients and healthcare workers. Thank you.
Thank you, Lorraine. Christy, could I invite you to come on next and say hello, introduce yourself, and tell us a little bit about what safer care means to you?
Good afternoon. My name is Christy Ruff, and I'm from the east coast of Canada in beautiful St. John, New Brunswick, which is also the traditional unceded territory of the Mi'kmaq, Wolastoqey, and Passamaquoddy nations. I have been in healthcare, I'd like to say since I was a child, because I always wanted to be a nurse and always wanted to take care of people. So I started my nursing career many years ago. I'm going to say almost 40. And I've been in frontline nursing care as well as managerial roles, administrative roles, and I'm now an executive director of culture and well-being at Horizon Health Network. And my background as a nursing professional has grounded my perspective. And I'm really pleased to be able to focus on building a culture in our organization where safety, well-being, and equity are inseparable. In my role, I lead initiatives that embed diversity, equity, and inclusion into every aspect of care and workplace culture. And what safe care means to me is that everyone, regardless of their role, whether they're a patient or a family member, their identity or their background, has a voice, feels respected, and contribute to decision making.
Thanks, Christy. It's nice to have you with us. Nancy, can I invite you to come on and say hello?
Thank you. My name is Nancy Humber. I live and work as an uninvited settler in the Statliam territory in British Columbia, where I enjoy the beauty and richness of this area, and I'm very grateful for the Indigenous stewardship of these lands through time immemorial, and I'm reminded what these lands might look like before there even was healthcare workers and before there was a local hospital. And my background, I'm a full service family doctor, an old fashioned one, I think, as people would think of it. I'm a GP surgeon, 25 years doing obstetrics and primary care, emergency room, and now more of a focused practice, doing outreach, clinical work in Indigenous communities, medical assistance in dying, hospitalist medicine, and emergency. Some of my non-clinical work, I have worked with health authorities in the past. I am a member of the Medical Services Commission in BC. I have a master's in health administration, and I hold some positions of a fellow in the Canadian College of Family Physicians. As a human being, I'm a mother. I have 6 children and a Great Dane who's very poorly behaved. And I'm honest when I say I only mention that I live and work in the Statlium territory because my time for playing is pretty limited. My connection to this topic I was reflecting yesterday, I think comes from the lens of inclusiveness and diversity. There is an old saying that together we're stronger than the sum of our parts, and I truly believe that. I believe that our collective strength, when our values and beliefs are aligned, that if we strive for interconnectedness of diverse voices, that better things can happen. I think this interconnectedness and this drive comes from my rural background when growing up in Newfoundland, living in a remote community, and then recognizing the reliance we have on strong team-based care, as well as that resilience that comes from that, from nurturing our interconnectedness as human beings. The All Voices in Safest Care, I think, celebrates our individual and collective strength of us as human beings and what we all can bring to the table, because I believe that we are the system and we need to work together to walk the talk and make the system work for those that care and also those that receive care.
Thanks, Nancy. Beautiful sentiments. Lots of threads I'm seeing coming through the collective experience of our panelists. So I'm looking forward to hearing them all weave together as we continue on this journey. And Harjeet, I'd love to welcome you to introduce yourself and share a little bit about your experience and what safer care means to you.
Hi, morning everyone. I am Harjeet Kaur. I am from Calgary, Alberta. I'm a stage 4 rare blood cancer survivor, patient advocate, patient partner, and digital storyteller. I was diagnosed back in 2019 with rare blood cancer, and I immigrated to Canada in 2018. So for me, it was a huge shift from navigating the healthcare system as an immigrant. There's a lot of challenges I faced during my treatment, and that's why I thought of using my voice. As a patient, I use my platform, social media platform, Instagram, HK Thriver for my experience. I also spread awareness and raise voice for those people in my community. Being a South Asian, there's a huge stigma around cancer, and you don't see our voices out there. For me, safer care means that it should be listened. We should be heard. Where patients and family members are partner, communication is clear, and every person feels seen, heard, and respected. Thank you.
Thanks, Harjeet. Just reflecting there for a moment on what you shared. And I don't know if everybody sees what I'm seeing, but there are hearts exploding everywhere on the screen. I think people are really appreciating your perspectives, your lived experiences, and what you're bringing to this conversation already. And so some of what I was really hearing as a central theme through all of what you shared was respect, right? About feeling seen, heard, respected, this being an embedded quality of our system. And then there was something that you said, Nancy, that really struck me, which was we are the system, right? We are the system. So, picking up on that thread, if we are the system, then, what are the actions that we need to take either personally, or in the context of our organizations that allow more voices to contribute to safer care? I feel like I'm going right for the heart of it. There was no warm up here. I recognize that. But I think that's really what we're trying to lift up today is what can we do? What are the small, the big, what are the things that really allow more voices to contribute to safer care? Um, Nancy, you really inspired me with that "We Are the System." How do you feel if I ask you to share your reflections first on that?
Sure. I guess I mentioned a little bit in my intro, and I feel like as a family doctor, I think because of that generalist lens, I have over the past 30 years of caring for people, recognize that I'm often seeing people and their families at their most vulnerable time, and just being respectful of that, that this moment in time is often the most vulnerable that many of these people have been as you're talking to them. And that spending a little bit of time during those initial moments is really important. And as Harjeet said, the time is to listen. So to be present, to be engaged, and to listen. And I'm always surprised that sometimes 2 minutes or 3 minutes seems like a long time to you as a physician, but to a patient, it actually means a lot. And in the bigger system of how long it takes to move and shift and do things, sometimes spending that extra time is all that it needs to build, as Lorraine said, that trusting relationship, that to remember that the presence of safety is not just the absence of harm. And it's your job in that moment to create a sense of safety and to build that trust and that engagement and to spend that little bit of extra time, carve off that little bit of extra space so that people have a chance to share what safety means to them. And I guess although it's more difficult to measure, is the psychological safety that we often forget in healthcare. That psychological safety doesn't come with a number or a metric, and you don't get a report at the end of the month to say how psychologically safe was your unit or were your interactions. But you get lots of information about how many medication errors there are and other things that are easier metrics quantitatively to track. So just to be aware that psychological safety is sometimes the most important things to patients and families.
Thanks, Nancy. I'm wondering how, as a clinician, how do you know if um, the patient, the family, the folks that you're supporting feel psychologically safe in an interaction together?
So for myself, I haven't always done this, but maybe over the past 5 years, probably since COVID, I always ask every person how their last hospital experience was. How was that for you? And then when patients tell me, I said, how can we make it better this time? How can we make your stay safer when you come under the umbrella of this hospital or in this interaction I'm having with you in the emergency room? So asking the question is very important, waiting for the answer. And I'm always surprised that the answer is often something that you as an individual could fix right in that moment.
Mhm.
So you could go and get a sandwich from the fridge. Sometimes it's I spent 10 hours in the emergency room and I'm hungry. So I think just sort of making sure you ask, and again, that agreement that we are the system and we have this individual as well as a collective responsibility to ensure that everybody feels safe.
Thank you. I feel like you just wrapped that up perfectly with a bow in terms of coming right back full circle to your original comment of "We are the system, and we are the care providers, we are the providers of psychological safety, and we each have the individual ability to really affect the safe experience of other people. It's not just someone else's job. The safety department, the quality department, it's that it lives in actions, small actions that we can each take. That was really a real thoughtful gift to share your personal experience and how you've, um, you know, created that safe space for people. Christy, I know you bring a nice organizational lens as somebody who's really committed to organizational wide safety in all of its forms. I wonder if you could share a little bit about what actions you think people or organizations more broadly can take to allow more voices to come in for safer care.
Yeah, absolutely. And, something that has inspired me over the years is my son was diagnosed with leukemia when he was 25, and I navigated the system as a mom with my son. And I had not had to do that as a nurse working on the floor and as an administrator, as a manager. I had not navigated the system as a mom. And I think that when you are on the other side and you're looking at things through the lens of a mom who cares about safety beyond all measure, because you want your child to be safe and protected and cared for, and all the things that we do to ensure safe care, our audits and the hand washing and all the things that we do those with great intent. But it doesn't become personal until you're on the other side of the coin. And for me, it became personal. And so it wasn't just a policy anymore after I experienced, it was almost 5 years in and out and a relapse and a bone marrow transplant and a long journey for him. And we experienced healthcare in a totally different way. And that has shaped how I think about the importance of forming policy, the importance of providing training, the importance of having healthcare workers understand that we're not checking off boxes. This is literally an important thing for us to do, and it makes a difference in the lives of people that we personally love. And I think if you can express to healthcare workers the importance of doing things because it's the right thing to do and how it impacts others versus we have to do this mandatory e-learning and it has to be done by January 1st. And now I'm on the other hand side of the coin. I'm in human resources and I'm influencing policy. I'm influencing training and providing training for our employees to ensure they can provide culturally competent care. I look at it differently. And I think that lived experience shapes us. And if we don't allow those things to shape us, then we really shouldn't be sitting behind a desk making policy decisions about healthcare. We need to do it for the right reason. At Horizon, we do it because we want to provide exceptional care every day to every person, and I truly believe that. And I'm privileged to lead a team of people who care about making care safe for people who wouldn't be able to when you think about globalization and so many different people coming, especially East Coast, this is new, for us in the East Coast to have such a wonderful amount of different cultures and beliefs and all of that within our hospital system. We've had to learn about that ourselves so that we can provide culturally competent care. And that doesn't just happen by accident. We have to do that intentionally, and we have to design it so that we're meeting the needs of our workforce so that they can then provide excellent care to patients every day.
Yeah, no doubt. And I'm imagining the scenario. Well, first of all, maybe contextualize this a little bit. We're at a really tricky time in healthcare, right? We have staff shortages. We have resource shortages. Like we have a lot of people being asked to do more with less. We have more complex needs within our patient care population and aging population. It's a little bit of a perfect storm going on. And I can imagine someone who may not have had your experience yet. And I say yet because we all will. We will all be family members or patients ourselves. But for someone who hasn't had the intensity of the experience that you've had journeying with your son, who gets invited to do, the training on, culturally safe care or patient safety or quality improvement, who at that moment thinks, oh, like another thing added to my list. But knowing that you're offering this with such an important intention, what do you think that health administrators can do to help folks really connect with the intention of that training and so that they can embed it in a good way, with the meaning and purpose behind it?
Yeah, thank you. I'll quote one of my favorite authors, Simon Sinek, and I'll say we have to start with why. And, if people don't understand the why behind what they're being asked to do, it's hard for them to fully embrace the reason. So whatever we can do as administrators to ensure that people understand the why behind, and that's making it personal. That's sharing stories. That's making sure people understand that the why is potentially your grandmother and your grandfather, but right now it's somebody else's. And having this knowledge and training, investing in this is going to provide better care. So we have to constantly link mission, vision, values. Why are we doing what we do? And we all went into healthcare because we wanted to help someone. We didn't do it for the exceptional salaries and the bonuses that we get and all those things when we're serving in a publicly funded administration. We're doing it because we genuinely want to make a difference, and we have to reflect that with our employees when we're asking them to do something. It's not easy. It's not easy. And you're right. Healthcare workers have an incredible demand placed on them right now. And so making it as easy as possible, listening to them. What do
Mhm.
you think would work? How can we
Mhm.
make this easier for you to get this
Mhm.
because it's important? You know, really listening and considering their feedback when you formulate plans
Mhm.
rather than just throwing out a plan and saying, you know, here it is, you guys have to do this.
Mhm.
Yeah, thank you. The why is so important. And thank you for lifting up storytelling. I think this is an important thread in the movement of patient safety. Is how do we tell those stories, link those stories, and make those stories feel like, they're right here in our community and not just out there to those people. It's such an important part. And so when we think about who it takes, to really elevate safety, right? We're talking about patients and families and clinicians, but we're also talking about our communications departments, right? And the people that help us get those stories out in big, beautiful ways. So really it is an all hands on deck effort. Lorraine, I would love to hear your voice on this. I know that you represent many hats in this space. And I would love to hear from you, what actions you think personally and organizationally really help to allow more voices to contribute to safer care.
Thank you. So I'm just going to sort of pick up the threads offered by Nancy and Christy. And we talk about creating spaces with diverse voices. And in thinking about the patients and clients and families, you have to be intentional. So it's not so much about, well, here's your survey, fill it out, but we actually have to give them a platform. And that platform has to be formalized, it has to be recognized by the organization, has to be supported by the senior management team. So for Holland Broadview, that looks like a family leadership program. I'm sure lots of hospitals have that as well. But really embedding those values within the organization and saying, this is the outcome of your feedback and really connecting those dots. In terms of, again, Christy, you were talking about the staff and creating that storyline. When you scratch healthcare enough, it's all of us. We're all on a continuum, from both middle age, menopause, old age. Somewhere along that continuum, we're going to be there. So I think it's really supporting folks in understanding that this is going to be me one day. You could come from a perspective of, you have a disability, you're racialized, you're middle-aged, you're whatnot, but it's going to be you. And, it's so important to understand that.
Thanks, Lorraine. I'm curious about the family leadership platform, and I know that there's probably many organizations that have started to create and shape that. But I think there are probably folks here who are hearing about that for the first time, and so I wonder if you can talk a little bit more about the mechanics of that and what it does and how it allows patients and families to have their voices heard. Oh, sorry, Lorraine, you're still on mute.
Sorry, could you repeat the first part of the question? I might have missed it.
No problem. Yeah, I was just curious about the family leadership platform and how it works. Thinking that that might be a new idea for some of the folks here on the call. So just curious as to when when you say that Holland Blue Review has a family leadership platform, is it a way of sort of inviting folks regularly to share about their experiences, or can anyone, if they have a question and concern, use that platform to have their voice heard? Or like, what does it look like operationally?
Oh, thank you. So, it's an actual program at Holland Blue Review. It's called Family Leadership Program, and centered on client and family-centered care values. So it consists of volunteers, so child, youth, and families / clients, and basically we partner with the hospital and co-design any client and family input. So they can contribute in various ways. So we have something called Family as Faculty. So they actually provide education to staff. We have family as mentors, so supporting other families on the same journey. We have family as reviewers, so reviewing health literacy materials, co-facilitating workshops, advising on research and quality improvements. And one of the requirements we have, for example, if there's any new hospital initiative, there has to be a family or youth leader involved. As simple as that. It becomes a criterion. And we're very careful about making sure there's not just a checklist. So it has to be a very distinct voice. It's not just the one family leader. We think about, let's have 2 or 3. And we also look at the diversity of voices. So not just the same families, but really trying to seek out a range of opinions.
Thank you for sharing that. What a great framework. So for those on the call who haven't yet implemented a system where you have community member engagement in a really meaningful way, what a great inspiration. And I love how you outlined it as, family as faculty, that opportunity to reverse the learning stream, right? And have your families be the ones teaching your staff about needs and priorities. And I'm really moved by this. And I'm sure there will be lots of people looking for evidence online about these pieces. So don't be surprised if you get a few reach outs on that. Thank you so much for sharing. And Harjeet, I'd love to hear your perspective, from a patient advocate perspective on what is needed to allow the patient voice to contribute to safer care.
To me, as I spoke earlier, that I was an immigrant when I was diagnosed, right? So for me, it was a really tough battle to navigate the healthcare challenges. Secondly, I was diagnosed when I was just 32, and it took them 3 months to diagnose my cancer. So I was treated as a research patient at that time because I was sick for 3 months. And I had no idea at that moment what cancer looked like, what would be the, post side effects of the treatment, what my life would be after cancer. And I think going through everything at that time, when I was diagnosed, from being diagnosed to, getting chemo, radiation, and going through a stem cell transplant during COVID, I learned a lot about the system. Honestly, at that phase, I was thinking of just, having a full-time job where I was just getting treated, go get yourself this medication, this, that. I think I was just in a full-time job at that moment. But lately, when I was going through my stem cell transplant, because I was isolated in hospital for 35 days by myself during COVID with none of my family member, none of my husband, like no one was there with me. At that moment, I realized that I need to start writing or start talking about my journey, because I felt, what if I don't survive? But I need someone to hear it out, because I was experiencing isolation, silence because of the stigma. We didn't talk about what me or my family was going through. Cancer just didn't affect me, it affected the whole family at that time. So I started using my voice online. So I started, talking about it online, thinking maybe someone out there, can help me or probably is going through the same thing at that moment. And because I was 32 and I was just thrown into chemo and radiation and stem cell, none of the healthcare system actually talked to me about menopause, about fertility loss. I did went through that and I had questions. Why is that so? So I feel by sharing your story, you can actually teach, healthcare that, these are the certain things which patient goes through. And I think patients should not be treated as, just a work thing. Okay, this is the treatment that is to given to them. They should be treated as human being. And I think everything should be cleared between patient and their caregivers, because sometimes it takes a toll on patients to, get into everything. So for me, I've learned that storytelling is a key when it comes to change and, bringing or opening doors for people. And also, I feel when patient or lived experience speak, healthcare learns. There are a lot of things which doctors or nurses are not aware what patients are going through as an immigrant, or as someone who has a diverse voice. Language is a huge barrier. I mean, I might be able to understand English very well or medical jargons with my experience of being advocate, but there are a lot of people who might not understand those medical jargons, or who might not understand what doctors and nurses are trying to tell them. So for me, just having that safe space, creating a safe space for patients and caregivers and their family members, probably bringing them to a panel or advisory groups, or also creating some digital campaigns for them where diverse patients can share their lived experience and can help turn feedback into a better healthcare system.
Mm. Thank you for sharing. You were so brave and so courageous in your approach and being willing to share your story. But I know that's not everybody's truth, right? I know that's not something that's in everybody's sort of natural way of moving in the world. And um, I also linked the cultural aspect to that. It's not in everybody's culture, right, to talk about their diagnoses and to talk about their fears and to talk about their past experiences. So my question for you is more, what does it sound like? What does it look like when you're in a treatment room with a healthcare provider and they're creating a safe space? So what is it that you want clinicians participating in this event today um, to know about how to have those interactions? Like, what can they say in that moment that would make a difference for somebody who is scared and who might not have the natural courage to share those concerns or fears or the things that are making them feel unsafe?
I think I had an example when I was told that I had stage 4. I was in a room, and we were about to leave country because I was sick for 3 months and I had no answers. And the doctors rushed into the room with my skin punch biopsy, and I was lying in the bed. And she just rushed in and she said, you can't leave. He got the diagnosis. And I was like, what? And then she just said the word subcutaneous panniculitis T cell lymphoma. And honestly, I had no clue what she was talking about. And I was like, what is it? Because I haven't seen someone in my family or back home talking about it. So I had no idea what she was talking about. She just said the word, and I was like, what? And then she said, you have stage 4 breast cancer, and we need to start the treatment ASAP. So at that moment when she said that, I felt it's over. I felt my life is finished. It's stage 4. I might not live. I might not survive. So I think at that moment when the diagnosis being told to patient, I think at that moment, I don't know what should be the tone like, but just to make them understand, that this is cancer and this would be happening, and that's how we are gonna treat, just to have that normal conversation and not sound like, okay, it's stage 4, it's cancer, and you're done. So that type of conversation, and especially when you have someone in the room, which was my mother, who heard the word cancer and she started crying. She just heard the word and she started crying, and I could not react to it because I felt this was too straightforward, just bringing on the table for her to take in, and as a patient as well. So I think just just to have that conversation very I'm not a trained healthcare person who can say that, but just having that conversation really slowly and nicely and making them understand. And yeah, that's it. And obviously there are cultural aspects when it comes to cancer in certain religion, right? And being a South Asian, because cancer is such a huge taboo, we it's a stigma. People think it's related to karma, it's contagious. So these kind of information, I know that's as I've been speaking a lot about this, not a lot of people in healthcare system know that, okay, this is a cultural stigma and taboo in our culture, in our community. So I think just to understand every communities and culture, what cancer looks like in their family, so just having that understanding.
Yeah. I'm going to just maybe take a pause here and invite any of the other panelists, if anyone wants to tag on to Harjeet's sharing or to reflect on Harjeet's sharing, from the organizational perspective, from a clinician perspective. Does anybody want to, to reflect on some of the notions of what we can do to support um, patients and families, particularly when they're receiving difficult information?
I'll just jump in and say I learned something new. Just even today, I didn't know that. And, I think keeping ourselves open to and sensitive to cultural differences is so important, and having open conversations about, I might not know and I might not get it right, but I really want to learn and I want to take the time to learn from you. So as a healthcare provider, opening yourselves up to recognizing that there are gaps in our knowledge as it relates to different cultures, different religions, and being open to learning more, and making sure your patients know that you're open to learning more and to meeting their needs from a culturally sensitive perspective. So I really value you sharing that today, and I learned something myself. So I appreciate that, and I think we always have to recognize there's something to learn every day so that we can take better care of our patients.
Thanks for that, Christy. Come on in, Nancy.
Yeah, I really appreciated Harjeet as well, you sharing your very brave story, and I also learned something from listening to your story. I did wonder from a physician perspective, because that's the lens that I most bring to the table, that I think when you walk into the room, there's this automatic hierarchy that you have the information of the diagnosis that the patient doesn't. And the offloading or the presentation of that information requires skill as a communicator and a collaborator with patients. And if there really is this attempt to flatten the hierarchy, then I think the first question before you share the information is, where are you? How do you want me to share this information? What do you already know? And just creating some space so that you actually understand how to communicate. So the communication, of course, in order for it to be equally shared, would have to understand where the other person is. And that would include your mother as your family member in the room as well. So I think maybe just to pause before the sharing of information to find out, with two-way non-hierarchical communication, you really need to know where the other person is. And actually, maybe that moment is not the right moment for a variety of reasons that you are unaware of. So maybe to ask first about sharing the information, and then asking first about how much do you already know, so you know where to meet that person and to meet them where they're at. So I think that was the lesson that I learned from hearing your story, maybe sort of that engaged focus for communication and collaboration to flatten the hierarchy before the conversation starts.
Thanks for that sharing, Nancy. And it reminds me of something that I learned from you from one of our earlier conversations, also around, there's the introspection at the beginning, that sort of like understanding where the person is at the start of the conversation. When you had shared a lot with me before in a different context, though, around the checking out at the end of the conversation. and asking those questions around, you know, where are you at again at the end? Like, do you have more questions? You know, like just trying to get a sense of how am I leaving you at the end of this interaction? And is there something that I can do to help you leave in a more psychologically safe way? I don't know if you wanted to add on anything to that.
I remember I tell everybody I am a card-carrying introvert, and I'm very aware of that during communication, and that often people need time to reflect and digest the information, and they do that in the quiet. And they do it without anybody speaking to them. So really important to find out how you close the conversation. So do you need to go away? Let them have some time and then come back? Or is it something that the style of communication is such that that person needs to talk through those questions that they have? Because everybody is different. But if you don't ask the question of how are you now and what would be the best next steps for you, then you don't actually know what the next step is. And maybe the next step is actually to leave you and your mother to talk and then come back later in the day and have another conversation about your questions or what the next steps might be.
It's a beautiful suggestion. I don't know that I've ever experienced that, and I can imagine what a difference that would make for somebody, particularly when they're receiving really big, life-changing information. Harjeet, another thread that's coming through you're sharing, is around culturally competent care. And a question from one of our participants today was to just understand more about what do we mean when we say culturally competent care? I know it's something a nuanced thing that we throw around. Lorraine, I'm wondering if you might be willing to start us off and then invite the other panelists to also add on to that question.
I'd love to do that. So, I'm just going to insert a little bit of my personal experience and then address the question. And, coming from a disability perspective, so I have a severe hearing loss. And, there's a lot of anxiety for me going to a healthcare professional, especially when it comes to communication. And, I don't think things that would do they look like me necessarily, but how do they relate to me? And, there's a lot of anxiety, I know, with clinicians where I don't know about this person's culture. What if I make a mistake? But I think it's about really creating that connection. We're not looking at you to be perfect. We're not looking at you to know all the answers. Just want you to be honest. So, I remember a few years ago, I had to go for ultrasound, and this was during COVID. And, they were fully masked, and, I was lost. And we only had one person at a time, so I couldn't have a spouse with me. And I let the technician know this, and she was amazing. She didn't talk, she just gestured, she used animation, she was miming what to do, and we had a perfect conversation without words. I thought it was great, it was perfect. And, to jump to the question of cultural competence, I don't know if we're ever competent in anything. I think it's about humility, really. It's about acknowledging I won't know everything about you. I can't possibly know your experience because I'm not your experience. But it's more about being curious. It's about that enthusiasm. How can I learn from you? How can I relate to you in a way that's tangible and meaningful to you in this given moment?
Thank you, Lorraine. What a gift your sharing was. Even for me personally, just that reminder that perfection's not the goal. It's never that's not attainable. The cultural competence is almost something it's out there. It's not here. It's not real. But the working towards it through humility right? Through honesty, through curiosity, right? That desire to want to know, how does that person feel? How does what I say make them feel? You know, and what are the gifts that they're bringing to this interaction? You know, that those are core foundations of cultural competence. Wow. Who else would like to add on to that? I feel like this is a big topic, cultural competency, and our experiences are so unique. So I'm guessing that that Christy or Harjeet or Nancy have other thoughts to bring to this as well.
I had the luxury in my work in the Statliam Nation of having some guidance from elders. And I am not a cultural humility expert, but I do know that it is a lifelong journey. And everybody is in a different stage of their journey, and it's our obligation and responsibility as healthcare workers to know where you are and know what the next steps are and to keep going forward. So that I know for sure. I also find that the Western medicine lens on how to deliver care is something that we're all very good at, but sometimes has nothing to do with cultural sensitivity, cultural humility, and culturally safe care. And sometimes a culturally safe meeting with a patient and their families is to sit in silence and to not talk and to observe the body language and the interactions and to build a trusting relationship before anything can happen. So I remember one person told me one time, how can I take a medication that you prescribe if we don't know and trust and have a relationship together? This was a very simple interaction. From my Western colonial lens, I simply saw somebody had hypertension. I wanted to give a medication for hypertension. I thought it would be a 10-minute interaction, you know, in my Western colonial lens. But there was no prescribing going to happen on that visit. In fact, it took 3 additional visits of trust and relationship building before that happened. So if I hadn't have asked the question, I would have left that thinking I gave a prescription and somebody would take the medication, which they had no intention of treating. And I had the luxury of understanding that before anything was going to happen with regards to a trusting relationship, it required more time and more visits in order for the next step to happen. So those experiences help guide me and remind me to always ask, how can I help you? Here's the information that I have as a Western trained physician. When you know that, how can I help you with the next steps? Where are you? What would you like for me to do? How can we work together? What do you need from me as a physician to actually make the next steps easier for you? And maybe not taking medication at all for several months actually might be the next step. Something I might feel very uncomfortable with, somebody with poorly controlled diabetes, something like that. But that is what needs to happen because that is where the patient is at that moment.
Thanks, Nancy. I'm actually really admiring the courage of that person that you were supporting and saying, you know, that they needed more, that they needed a different, they needed to build trust first. I don't know how many people would say that. I think most people would take the prescription and not fill it if they felt that they were not comfortable with it, might seek out care from someone else, hoping to get a different response. Like I think there's many different other outcomes of that scenario. So I just want to really acknowledge, you know, the courage that it took. And I think that a lot of what's been shared in this conversation, a lot of what's been offered up are ways to increase the likelihood that someone will say, we need to build trust first. I'm not ready yet, and I need this. And I think that's been a nice gift of this panel already in this conversation. Any other thoughts or reflections? Anyone want to share anything on this notion of cultural competence? Christy, come on in.
I'll kind of come in as an administrator again and talk about our responsibility to help develop those skills within our healthcare workers. And there's a wonderful program that we just started, and it's an intercultural development inventory. And so it's an opportunity for you to take a validated, test to see where you're at. With your cultural competence, and then also look and have a conversation with a trained facilitator after to say, okay, where do I need to grow? What can I improve in as a leader in our organization? And we're starting with our human resource department to help build, cultural competency within our human resource department. But I think, you know, taking the step to determine where you're at and then recognizing where you need to grow is so important. And being willing to say that you have lots of room to grow. And I loved the examples that Dr. Humber gave, as well as Lorraine with this. Like, it really is just being vulnerable and being vulnerable in the moment, and recognizing that you want to see people where they're at and help them where they're at. So, but I think there are tangible things we can do to help develop those skills within our healthcare teams. It doesn't Sometimes it doesn't just happen, and we need to provide opportunities for people so that they can develop those cultural competencies within themselves.
Yeah. And maybe, Christy, I'll keep you here on the line um, as a segue into another important topic. And this has to do with our newest and our youngest workforce. So we talked earlier about how these are tricky times, right? Resources are low, right? Staffing shortages, admin burden, um, post-COVID, burnout. And so now I'm thinking about, the experience of the new grad or the career, new career change person who's coming in, and they don't have the gift of experience to carry them through, some of the difficult situations. Um, how do we support, or what advice would you give to someone in this situation around contributing to safer healthcare?
What a great question. It's a challenging one. We welcome new hires, new grads all the time, who are very excited and fresh and want the ideal world that they experience during their clinical and during their education. And they come into this sometimes overburdened workplaces and an experience in that difficult times. And resiliency is challenging when you're new and you're young, and there's a lot of things that you have to face. And I think mentorship is really a key factor with all of our new hires in every occupation, and having people who are willing to step alongside, come alongside, mentor and grow new hires so that they can, especially ones, we're listening to some healthcare workers and some patients around this room, who would be wonderful influences on new people coming into any organization. So let's tap into the people who genuinely want to invest in other people's lives and give them the opportunity to do so, and also recognize them for that, because they're doing their own job too. And, so I think if we're going to try to, bring in all these new hires into a challenging system, we have to be prepared with systems to support those folks as they begin their journey in healthcare. And I hope that every new hire has the privilege and opportunity to interact with people like we've been interacting with today, and that they keep that spark that we want them to keep, so that we can provide excellent care. But that happens with intention. It doesn't happen by accident.
Yeah. Thanks, Christy. And I think also hoping, that new people have the privilege of making mistakes in supported ways,
Yes.
right? And so it's not the if, it's the when, right? We are human beings working in a very complex system, and things will happen. And how do we allow psychological safety, right, to be present for our staff new and experienced, as they're doing their best to provide the safest care they can.
And can I
Yeah.
just add something and then I'll
Yes.
stop talking?
No, come in.
But you sparked the psychological safety. That is also when we're considering healthcare workers a very culturally charged situation. We have a very open in our culture. We make mistakes. We talk about those mistakes and we learn from those mistakes. And that's the kind of culture that we want here in Canada, across our healthcare system, so that we can improve care for patients. Not all cultures are the same. And so when we're bringing in new hires from other cultures, and making a mistake could mean to them, am I going to be deported? Making a mistake could mean, is my family going to have to leave Canada? I made a mistake. I don't want to put an incident report in because I don't understand that it's safe for me to do so in this culture. And so it's critical for us to make sure we're making our new hires aware of the fact that in Canada, we embrace a culture of safety, and that includes telling the mistakes that we made so we can learn from them. And I'm so passionate about this because I've had lived experience with employees who were afraid to put an incident report in because of their immigration status. And so I think we need to be thinking about those things across hospital systems when we promote the importance of learning from our mistakes and creating that psychologically safe environment. A little passionate about this one, so.
I feel you. I feel that passion, and I think I'm seeing a lot of empathetic responses through our folks joining in online. Lorraine, I'd love to hear your thoughts on advice that you would give to newer people working in healthcare around contributing to a safer healthcare environment.
Absolutely. So I'm just going to jump off what you just said, Christine. You talked about psychological safety, and it's not always about comfort. So you create the space where it's safe to raise a concern, but it doesn't mean you're going to be comfortable doing so. I think it's really important to emphasize to new hires that you're going to make mistakes. Yes, absolutely, it's going to happen. And there are going to be scenarios where you're going to come face to face with something that creates discomfort. The important thing is that you acknowledge that discomfort and you come face to face with it, and you're safe doing that, but it's not comfortable. I think in healthcare we tend to avoid discomfort. You just want to smooth it over. And let's see, there's a way to express this. It's, do we have a debate, which is right or wrong? Do we have a discussion, which sort of smooths it over? Or do we have an actual dialogue, which is like a give and take? It doesn't mean you always agree with the other person, but you're actually communicating with that person. And, for new hires, I would say just listen deeply. Connect with your patient, connect with your client. Just really be in the moment, because we tend to think, 2 or 3 steps ahead in care. We're looking to the next patient, we're looking to the next, medical prescription, but be in the moment. Sometimes that's all the patient needs, be in the moment.
Wow. I'm just going to pause for a second. There was so much in that response. I think that just that little nuance around debate, discuss, and dialogue. I hadn't heard them put side by side like that before. So that was beautiful learning for me in what you just shared. The difference of debate, meaning we're trying to discern between being right and wrong. And when we're discussing something, we're just trying to smooth it over. But when we're really being in dialogue, we're each articulating in an honest way. And that dialogue often comes with discomfort, and that's okay. That's part of the human experience, and part of what we need to bring from both sides. That was wonderful. Thank you for sharing that. Nancy, inviting you to come in on this one too, on advice, thoughts, reflections towards newer grads and their ability to contribute to a safer healthcare environment.
I'm still reflecting on Lorraine's statements. They're very impactful for me. I like the idea of uncomfortable conversations still being okay. And I'm reminded of the fact that just because people are all together working as a team doesn't mean that they're functioning as a team. And we talk about team-based care and we put new people, new hires into a team and expect it will be the same as the team that was there before. And it's often not at all like the team that was there before. And I think that I live and breathe that the whole is more than the sum of our parts, but only if we figure out how to work together. And that our individual responsibility is to how to figure out how to work in the team so that the collective wisdom of the team and that interprofessional wisdom and the diversity and inclusion of the team can actually be as strong as it could be. And when you think of that, we are the team and we are the system, you actually have to think of that in two different levels. On an individual level, how am I going to be a team player with my colleagues, with my interprofessional team, with my patients? And how am I going to be a team within the system? And how is this team going to function within the system? And those things do require reflection and time. And as Lorraine says, courageous conversations that are uncomfortable. But through that uncomfortable conversation, the team will grow and become more resilient. And I think actually will be more of a higher functioning team. So I think that would be one thing that I think I would try to have new hires understand, that just because they're in a team doesn't mean the team is going to be perfect like in medical school or in residency. I think the other thing I would reflect on new hires is the importance of communication. So we are in a very advanced world where technology can help us communicate. So in order to really engage and be in the moment and connect with patients and their families, we have to be stellar communicators. So sometimes we need to use tools and technology to do that. We need to use pocket talkers. We need to use whiteboards. We need to use translators on iPads. We need to allow patients to write their questions down and come back the next day for people who can't think in the moment and ask all those questions at the time. We need to call families when we're in the room on the patient's cell phone by video and connect them in the moment. These are all things that are very easy within your sphere of influence that you can actually really make a difference in the quality of the experience of patients and their families. And I think also just reminding people that it's their responsibility. It's not the system, it's your responsibility in that moment to be a stellar collaborator and communicator. And then also just, I think I mentioned before, to be aware of psychological safety, that although you're not given those numbers at the end of the month and at the end of the year about how good you were with the benchmarks that are collected by the health authority or by your organization, that the psychological safety, if you ask patients, is usually and often the most important thing. And the thing that has impacted their care the most for their previous healthcare experiences. And if you don't ask, you won't know. And if you don't carve out the space so that it's equally weighted in your interaction, you also won't be able to deliver safe care.
Thank you, Nancy. Among each of those pieces, I feel like for me, the rainbow over top was really, a call to action for new healthcare providers to simultaneously be leaders. And just because you haven't seen it done doesn't mean that it's not in your purview to do. And it's that agency. I really hear that sense of wanting to impart agency into newer professionals, like that notion. I just had that visual in my mind of them walking into a room where the family wasn't present and asking to use the patient's phone to say, hey, can we call, your partner? Can we call, whoever you'd like to have as part of this conversation today, and getting that person on the phone and huddling them in. I think that call to action is really strong, that, it may not be status quo yet, but if you follow those principles and those values of strong communication, using all means available to you, ensuring that inclusivity and respect, and you keep applying those to every opportunity, that there's a lot that they can do that they may not have seen done before. Yeah, neat. Harjeet, I'm really curious from a patient's perspective. What from a patient's perspective, would you want somebody new into healthcare to really consider when they're trying to create a safe environment?
To me, I think with my lived experience, I had a couple of things, but one thing which I wanted to say to Nancy, when I was at stem cell transplant, because I didn't had family member at that time and I was going through chemo and radiation, and my oncologist at that moment, because I was transferred to a Tom Baker Cancer Center, he used to call my husband daily to give my update because I had, nothing to say. I was on IV fluids. I was on so much of pain during my stem cell that I had no idea to speak to my family what I was going through. But at that moment, they used to do that. So I appreciate that, having that kind of conversation, because when patients are going through something, they can't even digest the thing that, they have cancer. They have to go through so much things. So having that open communication and talk within, their caregivers or partners is really important. And also seeing patients as teammates, not cases. Sometimes it's like, people see, oh, I have this patient, he has this cancer, I need to sort this out, or I need to start the treatment right away. So, just thinking and, just taking a pause and being curious, as simple, how are you coping with it, or just understanding their cultural thing or language support, and, just providing that empathy to bring that, safer conversation for everyone, just to understand the patient more. I know that as Christy said, that it's tough for people who are newcomers and going through that, and then they feel that they do mistakes and stuff, and we are human beings, we all do mistakes, right? So I think it's okay, but just understanding your patient as a teammate is really important.
Thank you, Harjeet. That one really, really struck for folks. I noticed a comment in the chat saying that really stuck for someone here, the idea of a patient as a teammate. So every time somebody offers a new piece of wisdom, it connects with people differently. They may have heard the same thing in a different way from a different voice, but we often need to hear it, differently from different people. So thank you for your sharing today, because it's really resonating. We're kind of in the wind down period, starting to get more into maybe the final reflections around this topic before we transition into our end offerings. So maybe I can invite, well, I'll put the question out so you can all start to reflect on it. And then I think I might come to Lorraine first on this one, only because I think I recall you actually leading with this at the top of our, and apologies if I'm wrong and it was someone else, but one of the things that we've done here at Healthcare Excellence Canada over the last year and a bit is create a Rethinking Patient Safety Guide. And this is an invitation for folks to look more broadly at how we consider safety. And specifically, it really emphasizes psychological safety and spiritual safety. And one of the notions that's really prominent in this guide, and thank you to our team for putting it in the chat, is that the presence of safety is so much more than the absence of harm. I think for the longest time, we focused on incident rates, right? Hand hygiene, how many hospital-acquired infections. And these are all still really important things that we need to continue to strive to improve on. But safety, we know, is much more than just the absence of harm. So I'm curious for each of you, what does the presence of safety mean? Lorraine, if you wouldn't mind leading us off, that would be great.
For me, the presence of safety is about respect and trust. I have to, when I go into an interaction with a healthcare provider, I have to have the level of trust that you want to do the best by me. I need to know that you respect me as a human being. We don't have to look alike, we don't have to think alike, but you're going to give me the same quality of care that you would give to anyone.
Thank you. Yeah, you really have brought us full circle to where we started, and the notion of respect and trust. And that's when that's there, then safety can begin. Yeah. How about for you, Harjeet? What is the presence of safety? What does that mean to you?
To me, I think I do agree with Lauren. It's actually respect and trust, to be very honest. And being a patient, as a patient, I can talk freely about certain things and being understood by the team, because I feel lived experience do matter. So for me, having that trust between the healthcare and the patient is really important. And I feel like safety is in silence, right? After something is gone wrong. So for me, I think it's just two words: trust and respect.
Thank you for that. Nancy?
I think as well about holistic safety, as both Harjeet and Lorraine had described. But I also think that individually and as a system, safety would mean also preparing. So often when you think about those things that we equate with safety, which is medication errors, how many people died in hospital, post-operative complications, they're all things that have already happened. So we're always looking backwards, looking at what's already happened. It's beautiful because it's on a graph and it looks really interesting, and we can create some actions to try and improve it. But it doesn't do anything for this rapidly changing, very amorphous healthcare system that patients one-on-one on the ground on the microscopic level, and then in that middle layer where there's like health authority systems in place, and then on the macro level, the health system in general, we need to have actions and ability to plan and adapt to make sure patients stay safe in this changing landscape. And I don't think a policy will actually do anything, because it can't vertically connect through all of those layers of the healthcare system. So in order for that to work, we need to have values and beliefs, and as Christy described, like why we come to work. And we have to have very good collaboration and teamwork, but we also need to be able to have a system that can flex and adapt and respond in the moment on the ground. Like what is needed for this person, for this family, for right now? And am I the person can do it? And maybe you are. In fact, most likely you are the person who can make it safe. You might have to think about it differently. You might have to do a workaround. You might have to do something, but we need to empower the workers to be able to adapt care for the moment and ensure that it's safe for everybody at the moment. But then we also need to make sure that vertically connects to our policies that are in place to make sure we plan for changes in the healthcare system, because they are going to happen, they do happen. And if we don't prepare for them, then we're always catching up. And patients have already been unsafe before we change the policy to actually make it better for them. So I think that's sort of a little bit more of the thread that I like to think about when we think about holistic safety, but also preparing for safety to make sure we deliver the best care possible. So that would be my thought.
Thank you for offering that. Yeah, so that I really heard the need for flexibility, right? The absence of rigidity, right? We have a very amorphous system and we need that reflected in the way in which we are supported to practice across all layers of the system. And so, like you said, it's not about more policies. It's about more flexibility and for folks to also have that personal accountability to say, what can I do? What, this may not have been in my official job description, but really what I'm here to serve in the best ways that I can. That's why I came, into healthcare. And so where might I have agency that I didn't otherwise consider to really make a difference for the person that I'm face to face with right now? Yeah, that's such a strong, strong message. Christy, do you want to close us out on this one?
Yeah, sure. So I think the presence of safety means something different to every patient that's in the hospital. It can be the presence of safety for me with my son was that I saw the nurse wash her hands, period. That was safety. That meant a tremendous deal to me. In fact, I would even say, "Did you wash your hands?" And I felt kind of bad saying it, but I was like, you know what? I'm scared of germs. Germs make me scared. I don't feel safe and I need to see that you've washed your hands. And so that was the presence of safety to me in that context. I have a good friend whose mom's in the hospital right now. The presence of safety for her is that she knows she can call the nurse's station. She's going to get a nurse that's going to answer questions about her mom in the middle of the night. The person that's in the hospital alone who has no one at their bedside, the presence of safety is making sure the call bell is placed in a position that they can reach it and they can reach out for help if they need it, which is all things that some of those things we take for granted. They're things that we know we should do and we document it in our nurses notes and we say, all the things that we did to make the patient feel safe, but safety means something different for every patient. So I would say, similar to the thread that everyone has said here today, and I had all these notes I was going to say, I haven't read one thing, but, really listening to people, where they're at, what their needs are. Presence of safety could be having someone that speaks the language that you speak so that you can have the care that you need, which is the interpreter on wheels that was mentioned, earlier. So those are all things that contribute to the presence of safety for our patients. And I think, it's a big effort, not by just system, but by people. And I agree with you, Nancy, that a policy isn't going to make that better. In fact, maybe we need to break some of the rules, to make it better and, think about things a little bit differently so that we can ensure safety for all of our patients.
What a nice way to close off in that, recognizing that safety means something different to everyone. And it reminds me of a little resource that we developed on how to have safety conversations. Right. And Nancy, thinking back to some of your earlier suggestions around how to have those conversations, this is a new skill for a lot of folks. So we'll put in the chat a link to our safety conversations cards and activity to help maybe stimulate folks who haven't done this before in terms of having those conversations. How do we teach people how to have those conversations to understand what safety means to folks to then be able to respond to that in a good way? It also makes me think of the What Matters to Me campaign and the work being done through our partners at Health Quality BC and others that have put some great resources out on connecting people with what matters to them and how in a way that matters to them. I don't know what to say other than just my heartfelt gratitude to each of you, to Nancy and Lorraine, and Christy and Harjeet, for your courage, for sharing so vulnerably and so openly, for gifting so much wisdom over this time. I'm really excited. I was able to catch up with the chat at moments, but I look forward to digesting it more thoroughly afterwards because I know there was so much reflection and sharing going on in that space. And I want to invite everybody online, if you want to continue to engage with Healthcare Excellence Canada on some work that's going on right now. We have a Right Care Challenge that we're currently offering, which is a program that supports health and social care delivery organizations to launch or to enhance initiatives, hard to say that back to back, that ensure patients receive the right care at the right time in the right place. And this looks different in every context. So we invite people with all different approaches to doing this to join us in this movement. And really one of the overarching themes is how can we ensure more appropriate use of our emergency departments and reduce avoidable visits. So if you want to join this challenge, you can do that even through completing Everyday Safety Acts. So we talked a little bit at the beginning about, what are the things that we can each do in our own environment to promote safety? That would qualify for the Right Care Challenge and a chance to win a monetary award, plus access to other awards and opportunities to help sustain improvements that provide better access to care in ways that matter to you. So if you register by October 31st, you can be part of this movement, and we'll put some links in the chat. And I also just want to thank you, our audience. Thanks for tuning in. Thanks for your beautiful energy, your comments, your questions, your reflections, your challenges. We'll send you an email link with the recording. I know some folks have asked. We'll try and connect you with as many resources as we shared over the course of this session. And now we're going to launch a poll. So if you can stay on for 30 seconds, your feedback is so valuable to us for our future webinar design. So if you take a minute and let us know how this session was for you. Also, we have an email list. So if you always want to know what webinars are coming up or new resources are coming out, learning opportunities, we'll send it straight to your inbox if you want to sign up. And once again, thank you so much, Dr. Humber, Lorraine, Christy, and Harjeet, for your wisdom, your reflections, and your energy. This concludes today's event. Have a great day, everyone. Thank you.